Well, something that strikes fear in the hearts of every woman I know is bathing suit shopping. This year, though, you can actually look forward to finding the perfect bikini by getting your body ready for spring break and really summer right now. Dr. Therese Stubbs of Therese Aesthetic Medicine is here with some amazing body sculpting solutions. So always good to have you, Dr. Ann.
Thanks for having me.
So most people are still wearing sweaters. We were talking about, right? It's supposed to be winter right now. So why should we think about sculpting our bodies right now?
Well, a lot of times people hit the springtime or summertime and they've had trouble spots that they've not addressed before that. They put on the shorts, they put on the bathing suit, and things don't look exactly as they thought. So if you're going to do some type of procedure, it's good to give your body maybe a month or so to adjust and to heal. So things like smart lipo and cool sculpting can be working right now while we have the thin, the heavy sweaters on, so that when we wear the summer clothes, we'll be ready.
Okay, so let's start with that smart lipo, because a lot of these are minimally invasive, even non-invasive, these things you're going to talk about today.
Yes, and smart lipo is a surgical procedure, but it's done in the office under a local anesthetic. So the area that we're removing fat is numbed up with a local anesthetic, and then a tiny little laser the size of a piece of angel hair pasta, is kind of introduced just underneath the skin, and this laser melts the fat, it liquefies it. So we can do areas like arms, we can do tummy, love handles are probably our most popular area, inner thighs, outer thighs, even knees. I didn't know how many women hated their knees, but apparently so. But anywhere there's a little pocket of fat, we can melt that with the laser. Then we take an equally small little kind of suction catheter, a little straw, and suction that liquid fat out, and immediately the skin compresses down because the heat of the laser tends to tighten the skin over top. So it's a remarkable procedure. Usually even a belly and kind of love handles all around here would maybe take 2.5 hours. The patient wears just kind of a Spanx-like garment for the next week or two. It's great weather to hide that under a big sweater. You're up and around the very same day and usually can return to working out in about 2 weeks.
Well, the before and after pictures of this, it's pretty dramatic. So I want to look at this because a lot of women can identify, I think, with this before picture, especially just having a child. Things change. I mean, your body ages.
Exactly. And so the body tends to collect fat a little bit more around the midsection, especially after childbirth and with hormonal changes. Even men experience this after about the age of 40 when the hormones change. So this is a very safe procedure for just melting that fat. And this is fat that's right under the skin and it's above the organs. So it's not inside the body around the organs. There's no risk of basically hitting any kind of liver or bowel. I've had people ask me that. This is fat that's just under the skin that we can grab and that we can all perceive when we're wearing a pair of jeans and see it kind of herniating over the top of that. So this is fat that's right under the skin and very safely can be removed with the laser.
Something else that I think we all deal with, skinny or big, every woman has cellulite.
Exactly.
And there's something you have called cellulase.
Yes, and cellulite is particular to women. Men don't get it. So we found that the actual reason for cellulite is right under the skin. There are these little fibrous bands that pull down vertically, causing the dimpling, as you see on the patient on the left. So those dimples occur because there's a fibrous little band pulling downward. So we've had thin girls, marathon runners who come in with cellulite on the legs. It's not an exercise induced, or it can't be cured by exercise, I should say. This is something where we go right under the skin, once again with a local anesthetic, and this laser that we have interrupts those fibrous bands. And then we heat the underside of the skin, and the skin tends to build collagen, thicken, and smooth right over the top. And it's a permanent solution.
That sounds incredible and looks great to see that there is a solution.
Yeah, we're out 5 years from this technology hitting the market, and no one has regrown those little fibrous bands vertically. They find that they regrow kind of at an angle and they don't create the dimpling. So it's a beautiful way to alter the physiology and get a good result too. Very safe.
And something else that's become hugely popular we've talked about is cool sculpting.
Cool sculpting is probably the most popular body sculpting thing out there right now because it's safe technology. It can be used in people who maybe are on blood thinners and can't go through surgery, or diabetics who don't want to go through surgery because they have higher risk factors. This is something where just a cooling plate, there's a suction cup, and your area of fat is kind of frozen between two cooling plates for about an hour. And we found that when the fat cell in the body hits 32 degrees Fahrenheit or freezing, it pops open. open. And then once a cell is broken in your body naturally clears it with your own lymphatic system. So people, the picture you just saw, the lady went through 2 different sessions of an hour on each side of that bra fat area, and then we wait 30 days, we see how much of that is resolved, and then we treat the area usually again if it requires a little bit more. But you can see this is no needles, no surgery, just the body clearing those fat cells after that area's been frozen.
All right, Dr. Ann, I want to thank you so much. I do want to mention 20% off if you mention Daytime on the Smart Lipo, the Cellulase, or the Cool Sculpting. So go on, get your free consultation, and then try and get ready for spring break.
That's right. We're going to be ready for spring when it finally hits.
All right. Thanks, Dr. Ann.
Thanks for having me.